Hi, my name is Bernadette McGovern. I've been working here in Tallaght Hospital since more or less when it opened in 1999, actually, just shortly after it opened. I am the colorectal nurse manager for the services here, and my background would be also colorectal. I worked in the Mater Hospital under Mr. Ronan Connell, where I would have worked as the first stomach care nurse for the hospital there in the Mater for 5 years. I came to Tallaght in 1999 and I have seen obviously great changes in the services, lots of different consultants coming and going. And I suppose over the last couple of years I've looked at different issues within the services which I think are seriously lacking in some organisation. And I was looking at the waiting lists, specifically 2 years ago, at all the people on routine waiting lists for the surgical teams. So within that group I noticed a lot of, I suppose, young patients that were maybe coming in with basic complaints like painful piles or itchy tail ends or whatever. So very much the bread and butter, benign stuff of the service, which seems to me to be quite ignored really, because it wasn't glossy, it wasn't a tumour, it wasn't anything really that anyone would worry about. However, I suppose where I looked at this was that if I were going to a dentist with a sore tooth, I'd like to see that it would be done and dealt with quickly. And then I thought for some of these people that were directly referred by GPs with painful piles, that they literally went on a pile of lists to be seen by somebody within the departments of surgery. And we noticed not alone were they not being seen, but they were also being triaged to all sorts of different consultants. So I knew there were a lot of issues to be addressed. I suppose the numbers were there. There was great debate as to whether we needed to really address it, but I did feel strongly that it wasn't right to have these young people sitting around with basic benign conditions that weren't being looked at in over 4 or 5 years. And in fact, when we went back to look at the lists of the long waiters, the only reason why we did it was because obviously there was pressure from the HSC to try and clear our lists. So a lot of these people had gone to other departments or other hospitals, shall I say, for an opinion. So I decided, along with Professor Neary, to maybe look at some of those patients that might be suitable for a procedure clinic. And in fact, some of the letters from GPs were very clearly stating that the patient had a painful pile or a bit of rectal bleeding, bright red rectal bleeding with no family history. So it was very clearly indicated on GP letters that it was just a case that they needed to have an evaluation of it, or at least a proctoscopy to see if there was a pile there. So we identified obviously a group within that list that we could potentially see at a procedure clinic. And we decided to set aside one clinic maybe in every 4 to 6 weeks to try and clear some of that waiting list back. It was surely literally to clear a waiting list that we were pushed to do something like this. We already had the room, we had a located room which we used for all our clinics every week. So we had a procedure room and the staff remained the same. So it was myself and there was a carer and one other staff nurse. So we just started out with 15 patients potentially because we felt we wanted to see how it would go. Areas that we could question is how much prep do the patients need. Well, I found for the bulk of these patients they were young, and if when they came in I asked them if they had been to the toilet or if they felt they needed any suppository, they would go into the bathroom themselves and give themselves a suppository prior to their examination. But in our procedure clinic up to date, we have found most of the patients have been clear for examination. So I said that we used current resources in terms of our room, the current equipment which we have. We would send some of the connectors for the proctoscopes back to the HSSD department. So certainly we could look at getting just a one pack, fully disposable pack for proctoscopy or rigid scopes without having to send them to HSSD at all. So we need to do obviously a business plan and look at the cost benefit analysis there for those. Another aspect we felt possibly that we could introduce is using an information leaflet for the procedure clinic, so we could send it out to the patients to tell them what to expect on the day when they come, so that they're aware of what procedures they are going to be having. So currently right now our waiting list for procedures is under 12 months, so I would say it's very effective. We haven't actually done any survey with the patients, but verbally asking the patients on the day how they felt about their experience. Most of them would be very happy that they were seen and that they had been evaluated, had their problem treated. So in the initial period of the project that I did, I suppose we had quite a few patients that didn't turn up, and that was purely probably because they were on the waiting list for so long. They had either chosen to go somewhere else or they had forgotten about their problems. So we had quite a few DNAs initially, but then when we got into more recent lists, we found patients were coming. So our attendance rate was very good, and we had, as I said, the follow-up was through a telephone call, so very few had to actually come back to the department. So we were automatically reducing our waiting list and reducing the amount of patients coming back for return visits. So that surely must be a success. So our experience has been very positive to date, and certainly we would like to continue to improve on that, and maybe, as I said, consider rolling it out to other areas. And we would also be very happy to have anybody else that's interested in setting up the service in their hospitals.